So today's webinar is being recorded and will be available in the upcoming week on our NP SAN portal page. And a link to the recording will be sent to all registrants. All participants will be muted throughout the presentation, but I encourage you to submit your questions during the presentation. Please use the Questions tab on your GoToWebinar control panel as seen here to ask your question. It will then be relayed to the presenters and answered at the end of the webinar. Following today's presentation, a survey will pop up and will also be sent out in an email later today. We encourage you, and please ask that you take a few minutes to complete the survey evaluating this activity, as your feedback is truly critical to the ongoing development and presentation of our webinars. Additionally, the slides for today's webinar are available as a handout which you can access via the Handouts pane in your control panel. You can click on the name of the handout and it will download via your default web browser. So before we get started, let me just take a quick moment to talk about the national investment taking place for quality improvement in the United States with the help of our federal government and the organizations who are presenting this content as part of the Transforming Clinical Practice Initiative, which is also sponsoring today's presentation. The Transforming Clinical Practice Initiative, or TCPI, is CMS's largest ever investment in practice transformation, with an investment of over $700 million over 4 years and the enrollment of just over 150,000 providers across the country. The NNCC, or National Nurse-Led Care Consortium, is a membership organization with over 250 nurse-led practices on our membership roster. And our value is to, our mission is to advance nurse-led care through policy, consultation, and programs to reduce health disparities and meet people's primary care and wellness needs. Our partner in this initiative, the American Association of Nurse Practitioners, is the largest full-service national professional membership organization for NPs of all specialties. It's leading the way in advocacy, continuing education, and professional development for its over 70,000 members. CMS funded the NNCC and AANP to support enrollment of NPs into practice transformation networks, or PTNs, across the country, and to also develop NP-specific educational material that really facilitates practice transformation in advance of upcoming payment reform changes with CMS. Both of our agencies, NNCC and AANP, agree that this initiative is important and vital to ensure that NPs receive the support they need to remain competitive in a changing healthcare landscape. We believe that NPs are the future of primary care in the United States, and they already provide high-quality, cost-effective care. What this initiative does is it provides NPs with an opportunity to then prove it by helping CMS and the broader healthcare community build the evidence base on practice transformation while preparing for value-based reimbursement. But we must note that CMS is not providing this funding out of the goodness of their hearts. They want to use this program to prepare clinicians across the country for payment reform. In particular, payment reform under MACRA, or the Medicare Access and Chip Reauthorization Act. Many of you have probably already heard of MACRA. It's legislation that was passed to establish Medicare's Quality Payment Program, or QPP. Under this quality payment program, there are two payment adjustment mechanisms to incentivize quality tied to Medicare Part B payments: MIPS, or merit-based incentive plans, and advanced APMs, or advanced alternative payment models. Most clinicians will end up associated with MIPS, or the merit-based incentive plan. But we must say that the details of this aren't as important as the general trend. MIPS involves 4 elements that clinicians need to demonstrate successfully to maximize their Medicare Part B payments. These elements are to 1. Report on quality, 2. Report on resource use, 3. To identify clinical practice improvement, or CQI, activities that they are engaged in, and number 4, to use health IT effectively. Even if you think that MACRA or MIPS doesn't apply to you, if you can demonstrate these 4 elements in your practice, you truly can succeed in a value-based payment environment. The TCPI and their networks are meant to provide clinicians with the skills necessary to execute these 4 elements in practice. So we already know that NPs have a large and growing role in the delivery of healthcare, especially in primary care. NNCC and AANP want to connect NPs to TCPI-funded practice transformation networks. These peer-based learning networks have the responsibility for enrolling and supporting clinicians. They provide free, I repeat, free boots on the ground, technical assistance and support to help realize practice transformation. So how can NPs help PTNs by serving as their leaders in their networks? Easy. NPs are more familiar with many aspects of the change package than physicians, and NPs already have experience working in collaborative, interdisciplinary, team-based environments. Practice transformation networks, or PTNs, can provide NPs and nurse-led health centers with critical resources for practice improvement, access to larger networks of clinical peers. This helps pull NPs and smaller nurse-managed health centers out of isolation. So from here, I'm going to go ahead and turn the presentation over to the RScan team and where they can introduce everyone to their great resource.
Thank you, Tiffany, for the kind introduction, and thank you for making some time today to allow us to present RScan to all your audience. So next slide, please. My name is Max Wintermark. I'm an RScan clinical advisor, and I'm also a neuroradiologist working at Stanford. And I want first to introduce the rest of the team. So Jason, please.
Hi, everyone. My name is Jason Hom. I'm one of the internal medicine physicians at Stanford.
Thank you, Jason. Next slide, please. Jane, could you please introduce yourself? And Jane, you may need to unmute yourself. And while we're waiting for Jane, Nancy, perhaps do you want to introduce yourself?
Sure. Good afternoon, everybody. My name is Nancy Fredericks. I'm the RScan Program Director and a staff person at the American College of Radiology.
Thank you, Nancy. Jane, are you back on the line with us? Again, you may need to unmute yourself.
This is Tiffany. I can introduce Jane in her apps in the meantime. So also on the call today is Jane Anderson. Jane Anderson is holds a doctorate in nursing, or a nurse practitioner, and is a practicing nurse practitioner with the University of Minnesota. She holds her own clinic and is additionally a member of the TCPI National Faculty. So we thank Jane for her presence today on the webinar.
Yes, so thank you, Stephanie. And Jane probably has a technical issue and is going to be back with us very soon. So next slide, please. So today what we hope to accomplish is first to give you an overview of RScan so that at the end of the presentation you're all very familiar with what is RScan, and especially we would like to make sure that you understand why nurse practitioners should be interested in participating into RScan. We'll give you some very practical demonstration on how it works through an example. And then we'll show you also how RScan ties in with those macro and PAMA legislations that Tiffany mentioned in her introduction. We have a very comprehensive website with RScan where you can find all the information that we are presenting today in this webinar. So we'll show you also that website. The web link is rscan.org, but again, we'll get back to that later. And we'll finish with the next step on how to start with RScan if you're interested in participating. And we'll, of course, be happy to take any questions that you guys might have. Next slide, please. RScan is basically a part of a transforming clinical practice initiative that Tiffany described in her introduction. It is actually one of the 10 TCPI strategic alignment networks that were funded by CMS as part of the TCPI initiative. And it also includes a nurse practitioner, Sam. Next slide, please. So the goal of RScan is to support more than 100,000 clinicians and clinical practices, including nurse practitioners, to improve care delivery. The ultimate goal is to improve the outcome for millions of patients and also to reduce unnecessary hospitalization as well as unnecessary tests and procedures. And our scan, as you are going to see, focuses on imaging tests and imaging procedures. And so again, the goal is based on evidence to go through that transformative process so that we can provide better healthcare, generating better outcomes for patients at a lower cost with a significant amount of savings, as you can see on the slide. Next slide, please. The RScan project relies on a collaboration. Again, it's centered around appropriate use of imaging, and it's really the cornerstone is a collaboration between radiologists and referring clinicians, again, including nurse practitioners to improve patient care. The goal of our scan is really to make sure that every single patient receives the appropriate imaging test at the appropriate time for the correct reason, so that, again, we can make sure that we don't do unnecessary imaging tests, where, again, the evidence contained in the Choosing Wisely guidelines, and that we were able to contribute to lowering the cost of care. Next slide, please. So there is really a lot of flexibility in terms of how our scan can work. We're going to, again, give you an example in a minute. The goal, again, is for a radiologist and a clinician, again, in a very broad sense of the term, nurse practitioner, primary care physician, specialist, anybody basically who has an interest in improving imaging care, reducing the number of unnecessary imaging tests to be involved. And we are going to give you, again, an example later on how it works practically. But first, I wanted to go to the next slide and ask Jane to comment a little bit on why this program makes sense for nurse practitioners. So Jane, please, and next slide. And I hope we got Jane back on the call.
It doesn't look like Jane has been able to join us just yet. Nancy, would you mind saying a few words about why RScan is relevant and applicable to nurse practitioners?
Sure, and I think as Dr. Wintermark explained, that really the interest of RScan is to work with any clinicians who order imaging exams, and really clinicians who have an interest in learning more about how they can order exams of the highest value and really have high impact on patient care. And I know in talking with the nurse practitioners at NNCC that they made the point that there are many nurse practitioners who practice in rural settings, and we'll talk a little bit during the demonstration about how RScan can be carried out in anywhere from in large academic centers to in very small rural settings. So it really is a tool that's flexible for all. Part of RScan is we provide a number of educational materials, and we'll be talking a little bit about those later as well, that we think should be of interest to clinicians who order imaging exams. Next slide, please. And I think as Max has really driven home is RScan at its very core is about collaborations. It's about communication and clinicians working together to order imaging exams, again, that are going to have the most value for our patients. And also, and again, we'll be talking about this as it pertains to a couple of tools, but it provides nurse practitioners with tools that they can consult so that they can make the best decisions when ordering imaging exams. And with that, I'll turn it back to Max to continue us through the program.
So thank you, Nancy. And I think also what you just said ties in very nicely with what Tiffany mentioned in her introduction. Nurse practitioners on the front line, they form also a very tight group. They communicate with each other a lot. Sometimes they know more about those initiatives such as TCPI than physicians. And so they are really in an excellent position when it comes to imaging and imaging appropriateness to basically disseminate the knowledge and to use and propose to use the tools that we're going to describe as part of RScan. So next slide, please. So perhaps as our next step, we want to give you a very practical example of how RScan works. And for that, I'm going to have this discussion with my colleague, Dr. Holm, who is on the call today. And together at Stanford, again, that's the first step. It's this collaboration between Dr. Holm, who works in family and general medicine, and myself in radiology. And we have basically been focusing on one of the Choosing Wisely topics. So as you know, the Choosing Wisely is this campaign where a number of societies have contributed to define the tests that are not always used appropriately, and a number of them are imaging tests. And the one that we decided to focus on with Dr. Holm was imaging for low back pain. And as you know, imaging can be helpful in patients with low back pain, but there are also a number of situations where imaging is not necessarily appropriate for low back pain. And Dr. Holm, whom is going to speak, and we're going to go to the next slide, is going to explain a little bit the process that we went through at Stanford to address that topic as part of ASCAN. So Jason, please.
Great. Thanks, Dr. Winnemark. And just to reiterate, I think as Dr. Winnemark mentioned, I think RScan is a terrific opportunity for referring clinicians, nurse practitioners, family medicine doctors, internal medicine doctors to really work in a collaborative effort with radiologists to promote high-value care. I think as you saw on the last slide, as you know, one of the big emphases for high-value care is on imaging for low back pain, since that's one of the most common complaints that patients have when presenting to care, and in a large number of cases it's musculoskeletal pain that will spontaneously resolve, and imaging is not necessary. I think one of the important things to emphasize with RScan and related efforts is that the goal is to reduce inappropriate imaging while simultaneously not reducing appropriate imaging to maximize high-quality care for patients. So as you saw on the last slide and on the current slide, various specialty societies have come up with lists of red flag symptoms for which imaging is indicated, and you'll see some of them here. As you can expect, things that are concerning for fracture, neurologic deficits, spinal infection, those sorts of things. And whether plain films or MRI are initially recommended, ACR does provide tools to help you determine what's the best imaging test if indicated. Next slide, please. So one of the things that we wanted to do at Stanford was to quantify kind of the scope of the problem of inappropriate imaging at our own institution. So what we basically did was collect some baseline data during a 6-month period where we worked with our hospital finance department and with our medical informatics department and with the radiologists to look at all the MRIs that were ordered for low back pain during a baseline period, and then using manual chart review in conjunction with ACR's appropriateness criteria tool, we then retrospectively looked at what proportion of MRIs were ordered appropriately versus inappropriately and found that about 70% were appropriate, about 30% were inappropriate. And this is actually fairly consistent with national data as well in the literature. And stratifying the MRIs that were ordered inappropriately, we find that some of them were ordered for low back pain on initial presentation without red flags. Another subset, MRIs were ordered as the initial imaging test for low back pain that was a little bit more persistent when plain films probably would have been sufficient as an initial imaging test. Next slide, please. As our next step, I think one of our goals is to do a patient-centered intervention using flyers where we hand them out to patients whose initial triage complaint is low back pain, to emphasize that imaging may not be necessary. And I think one of our points of emphasis that we want to make to patients is that it's not just about cost, although that's certainly an issue, including with co-pays and so forth, but also that if imaging is done unnecessarily, it can lead to incidental findings, potential patient anxiety, potential unnecessary procedures, and concomitant complications. So there's a lot of situations where we think less is more. And one of our goals in doing a patient-centered intervention is to try to encourage high-value care and reduce inappropriate imaging utilization while simultaneously not affecting patient satisfaction, and really trying to encourage patients to take ownership over their care. Next slide, please. And at this point, I will turn it back to Dr. Winnemark to highlight some of the educational resources that are available for patients on this topic.
Thank you, Jason. That was a great overview. So basically for the audience, again, you can see quite a simple process for RScan. A baseline assessment, then intervention. We're going to discuss those in a minute. And then after the intervention, basically a repeat of the baseline to determine whether the intervention had any positive effect or not. And hopefully it had positive effect. And so relatively simple process. And as Nancy mentioned earlier, a process that is very scalable. So it's something that can be done in an academic setting or in a private practice setting. It's something that can be done in a city or in a rural setting. So really a lot of flexibility also in terms of how many groups are involved. It can be just a couple of nurse practitioner and radiologists, so it can be large groups that are involved at a medical center level. So really a lot of flexibility in terms of what to do. What RScan provides also is a lot of educational resources. We like to refer to it like it's like a menu in a restaurant. So not necessarily everybody is going to eat everything that is on the menu, but you can probably find on the menu some items that are relevant to your specific practice and to the specific issue that you're trying to address. As Jason mentioned, in our case, basically, we realized that a lot of the education needed to involve not only the prescribers of imaging, but also the patients, because often the patients come with their own ideas. They know exactly what they want. They have read on internet that they should get this particular imaging test, when actually perhaps it might not necessarily be the most appropriate approach. And so a lot of patient education is needed. So in our case, we looked at the menu that is available on the RScan website, and we felt that patient education material was helpful. So we have those the consumer report design choosing wisely recommendation, where basically they explain to patients in lay terms why imaging tests are not always the right thing to do. We also have some instructional videos that also originate from the Choosing Wisely campaign. Next slide, please. And there are really a slew of additional material that you can find there, podcasts, articles, as well as a number of activities. Some of them also give continuing education credits, so something that is definitely quite broad, again, so that any practice, independently of the topic that they pick, independently of their size, their setting, can find a couple of interventions that can be helpful. And we try to grow that menu as we go, because as more and more practices and groups participate in RScan, we ask them to contribute the great new tools that they develop as part of their process. So that was kind of an overview of how RScan works. We'll be, again, very glad to take any questions that you might have later. But before doing so, I'm going to hand it off to Nancy, who is going to tell you our R-Scan ties in basically with the PAMA legislation, and she's also going to give you a tour of the R-Scan website. So Nancy, please.
Thank you, Max. Next slide, please. So I think another really important benefit of R-Scan is that it provides participants an opportunity to gain experience with imaging clinical decision support. And the tool that's used in R-Scan is called ACR Select, and as Max said, I'll demonstrate that in just a few minutes. But for a little bit of background, ACR Select is the electronic version of the American College of Radiology's appropriateness criteria. And the appropriateness criteria are based on evidence, and they were created to provide guidance about ordering imaging exams that really add high value for patients. So beginning in January 2018, the PAMA legislation that was created back in 2014 will begin to require that clinicians who order advanced imaging exams, MRs, CTs in particular, demonstrate that they've consulted appropriateness criteria when ordering the exam. And a significant intended benefit is to reduce and maybe hopefully eventually eliminate the need to acquire pre-authorizations for advanced imaging. So the idea is referring clinicians will demonstrate that they've looked at appropriateness criteria and that they're making the ordering decision based upon that criteria. So really engaging in R-Scan provides a nice opportunity for you to become familiar with imaging, clinical support, and just be able to kind of kick the tires for that type of resource. So with that, Tiffany, we can go to the next slide, and I'll do the run-through of the R-Scan website. Okay, so everybody should be able to see the R-Scan website, and as Dr. Wintermark mentioned, all of the tools and resources necessary to participate in R-Scan are on the website. I'll just go through the quick overview that if you're interested, we have a pledge form. It just is letting us know that you might be interested in participating in our scan so we can reach out with more information. But the first step really is to work on developing a collaboration team and in choosing a topic that makes the most sense for any particular setting. And so we had a panel of experts who looked at all of the imaging topics in the Choosing Wisely program, and they developed a subset that they felt would have sort of the biggest bang for our buck in terms of if we focus on these exams, then we'll have an opportunity to kind of really move the needle and make sure that the exams that are being ordered provide true benefit for patients. So we have like admit for pre-op X-ray. I'll demonstrate today for you the ordering of CT angiography for pulmonary embolism. As Dr. Holman Wintermark pursued at Stanford, there's imaging for low back pain, and then we have a number of neuroimaging topics, imaging for uncomplicated headache, a few pediatric topics, and we've just recently added a topic for minor head trauma. Also, I'll point out that while there's good benefit in pursuing one of the topics that are from the Choosing Wisely campaign, that there's also an opportunity to define your own topic, and this might be particularly of interest for practices in small or rural settings. So this would be an area of the website to explore for more information about defining your own topic. So to go back to the guide, so you develop your team and identify your topic, and then I'll demonstrate in just a minute in how we use the ACR Clinical Decision Support tool to evaluate some imaging cases that were performed at baseline. And as in the case of Stanford, they discovered that 30% of the images ordered were likely of of low to medium value, and so then that provides an opportunity to carry out an educational program. And as we saw in a few slides, we've got a lot of materials. Here's for imaging for low back pain, some of the materials that Dr. Homan Wintermark used at Stanford. So our goal is really to make the project turnkey so that all of the materials necessary to carry out the program are readily available. So you carry out the educational program, and then after you again review cases, mostly retrospectively, to see if through the education and the collaboration, if image ordering has improved for the specific topic. So that's the overview of how it works on the public-facing website. There's a lot more information that can be learned. We have an FAQ, some news items, information about sites that have completed the RScan project and their results, and just how RScan relates to TCPI. So a lot more information that can be found on the website. But when you're ready to start, you simply log in to the back end, and an ACR username and password are needed, and we can easily provide those. It's free of charge. The program in of itself is at no cost. So now we're in what we call the Scan Workspace, and I'm just going to demonstrate how it would work if you were going to carry out the topic, the ordering of CT angiography for pulmonary embolism. And so the first thing that you would need to do is to register for the topic. It's a very, very simple registration process. All we require is that there be a radiology practice that's participating with referring clinician, just so that we can demonstrate that a collaboration is taking place. So very straightforward registration. And as soon as you register, then in the Enter Cases component of the website, the registrations will appear. I've registered for 3 topics. That's why we see 3 different registrations appearing. And so I'm going to demonstrate how you enter cases using the ACR Clinical Decision Support tool. And I'll also just stop here just to mention that the intention of Clinical Decision Support is to assist providers at the point of ordering an exam in a clinical setting. When it's integrated into a hospital's or a clinic's electronic health record. However, we're able to use it for the purposes of this project to evaluate exams and to enter those exams into the RScan database. So we're using it for our RScan program a little bit differently than how it would be used in a true clinical setting. So as soon as, let's say I'm sitting down with radiology colleagues, maybe some nurse practitioners from an emergency setting, and we're going to be looking at some of the exams that were ordered for CT angiography. So when I click Enter Data, actually I'm entering into ACR Select, and I'll just give you an example of how it works. Say it's a male case, click on chest, and then we can search on pulmonary, and all of the, oops, spell it right, all of the instructions are available on the RScan website for how to navigate through entering this information. So let's say that we're looking at a case, it's of intermediate probability, there was a positive D-dimer, that a CT angiography would be an appropriate test. Simply accept. And this is actually entering data into the RScan database. And I'll just show one other quick example. So let's say this time it's a CT, and we'll choose another clinical scenario. Let's this time choose a clinical scenario where the case suggests the patient was at intermediate risk for PE and there was no D-dimer. So we'll select that clinical scenario, and up pop the imaging exams and the appropriateness criteria, and we can see that this has a low score, but because it was something that was ordered, we're going to select it. We'll proceed with the exam. Maybe the reason why that exam was ordered is unknown. You can track some information of you can track some information in the comment area. And again, when I click accept, it's entering information into the RScan database. And so I'm just going to show you now what happens. We just entered a couple of new cases, so I'm going to refresh the case list, and then we can see the corresponding report. So this is the baseline data that I've entered to date, the number of cases, the average appropriateness criteria, and then we can see the extent to which the exams at baseline have been low, medium, or high value. And for this example too, I also have entered in some post-education data, so we can see how it has changed from baseline to post-education. A list of the cases are presented. We can see here the two cases that that we've looked at. So this is the reporting that is provided to the teams participating in RScan. And also, I'll just quickly point out that, as I mentioned, a great opportunity for referring clinicians is that we also provide just a practice opportunity so that clinicians can get to know how clinical decision support for imaging works in general. So you can just, for instance, let's say we're going to be looking at the low back pain topic, and here's the no red flag. And then again, all of the possible procedures and the appropriateness level of those procedures. So it just provides an opportunity for clinicians to become familiar with clinical decision support. And as we've mentioned, a number of the resources, educational resources, have corresponding free CME associated with them. So that's a very quick run through of how RScan works, and I'm going to turn it back over to Tiffany to go back to the slide set. So as I was mentioning, we would be delighted to work with nurse practitioners to get a project up and running. We can introduce you to radiologists. We'd be happy to work with the radiology team to get them on board with RScan, but we would be very excited about having nurse practitioners take the lead in getting an RScan project up and running. And feel free, here's my name and email address. I'd be happy to answer any questions that you might have, either in today's Q&A session, or feel free to get in touch in the future. So with that, Tiffany, I'm going to turn it back to you.
Great, thanks so much, Nancy. So for the remainder of the time we have available, which is about 15-ish minutes, if you have any questions for any of our presenters, Nancy or Drs. Home or Wintermark, please go ahead and type it into the question tab on your GoToWebinar control panel. But I'll give everyone a few minutes to kind of formulate their questions. We have a couple that are populating into the menu right now. In the meantime, while you're typing up your questions, I'll let you know that you can learn more about TCPI or any available practice transformation networks and training resources available coming out of the Nurse Practitioner Support and Alignment Network by emailing myself, Tiffany Depew, or going to our NPSAN website. But in the meantime, let me just go ahead and go down the list of the questions that we have. So the first question that we have is coming from Kara. Kara is asking if we can provide claims data and can we retroactively look at data to see if imaging was appropriate?
I'm happy to take this one. So yes, we can, I will let perhaps Nancy talk about the claim data, but in terms of the retrospective versus prospective nature of the project, so yes, there's a lot of flexibility. To come back to the example that Dr. Holm and myself worked on, basically our baseline was retrospective. We just sat down and we looked back at the last couple of months to see what had been done, and we used the tool that Nancy demonstrated, this ACR Select tool, to kind of grade the appropriateness of those studies that were identified retrospectively. And then our plan is we're going to conduct the intervention, then wait again a little bit, and then again kind of retrospectively look at the data for the period of time after the intervention. So that's one way of doing it, but again a lot of flexibility, and there are also ways to do that prospectively, but again a lot of flexibility. And I don't know, Nancy, if you want to comment a little bit on the claim data?
Yes, actually yesterday we spoke with a practice in Colorado, and one of the things that they were doing to determine what topic would be best for them to pursue was looking at some claims data and seeing what were the most frequently denied procedures, and they found that a real pattern related to imaging for shoulder pain. So that's one way that looking at claims data I think can help guide an RScan project in determining what might be the most valuable topic to focus on.
Great, thanks so much. And let's see here. It looks like our colleague Jane Anderson has been able to connect with us. So, real quick, Jane, can you hear us?
Yeah. Do you hear me now?
We can. This is very exciting.
They had me muted on your end. I was starting to take it personally.
Please take it personally.
Yeah.
We do have a couple of extra minutes available. If you're okay, I would love to kind of rewind a little bit to your
Sure.
specific slides, just so you can speak to the end perspective.
Yeah, that'd be great. I can introduce myself while you're going back to those slides, Tiffany. So I'm Jane Anderson. I'm a nurse practitioner, 26 years. I'm located at the University of Minnesota. Sort of. I have an independent practice through the University of Minnesota. I am the director of our nurse practitioner clinic. We're in an independent practice state, so there's some very specific and unique things about that applies definitely to how RScan can be helpful for nurse practitioners. I'm also on the national faculty for TCPI, and again, it would be very important if people would familiarize themselves with the concept of TCPI, as well as MACRA and MIPS and some of the other things that both Tiffany and Nancy have referred to. I think we need to, as nurse practitioners, definitely become aware of a lot of this terminology. But as far as RScan and how this can be helpful for nurse practitioners, this Choosing Wisely truly focuses on decreasing unnecessary additional testing and costs for patients in the TCPI program. It is definitely part of our initiative to be looking at unnecessary costs for patients, unnecessary costs for everyone, including our systems. This also is important for cost-effective in the rural and underserved areas. It is an excellent resource for our practitioners that are located in those areas. And in other facilities where it's difficult for patients to access care. We have nurse practitioners out in the field who really are independent and need to have a resource available to them to feel good for themselves and their patients they're ordering imaging appropriately. It is a primer for nurse practitioners on the use of these services. It's excellent training. We don't really receive, at least I haven't in the several programs I've been involved with, we don't receive that training in this format where it's very friendly, user-friendly on how to use the system of the RScan product, but also very clear in what imaging is appropriate and most cost-effective. Next slide. This facilitates collegial collaboration with radiologists and, frankly, with other members of our healthcare team. The radiologists are extremely helpful in helping us best understand not just this is how you do it, it's actually understanding why it is done in that fashion as well. And it empowers nurse practitioners to make evidence-based clinical decisions, which is obviously extremely important in our practice and extremely important in moving into the future of practicing as both independent and collaborative providers. So this is when I would have turned it back to Max.
Thank you so much, Jane. We really appreciate your patience for sticking with us.
Sorry about that. I don't know what happened, but
well, glad to have you on the call regardless. So from here, let's just continue on with our Q&A. The next question comes from Joyce. Joyce is asking, how is RScan integrated, or is RScan integrated into EMR?
Hi, this is Nancy, and RScan is not integrated. It's a standalone product, and it really is a stepping stone for when clinical decision support is integrated into the EHR. What RScan provides is a web-based standalone opportunity for clinicians to get on and just learn how it works. We've had a number of practices who have engaged in RScan just explicitly as an introduction to clinical decision support, so that at the point in time when they're using it clinically, which will be required in 2018, that they have familiarity with the program and can help guide the implementation of clinical decision support as well. So our version is a standalone version, and again, a stepping stone to when imaging clinical decision support is integrated into the medical record.
Great, thanks, Nancy. So a couple of questions have come in about the cost of the program. Is there a cost for radiology facilities to participate? Are there costs associated with the use of this tool, etc.?
There is no cost. Go ahead, Max.
I'm just to introduce your response, saying that everybody is going to like your response.
Okay, yes. No, actually, there is no cost involved, and we're funded as part of the Transforming Clinical Practice Initiative, and because our project is really focused on collaboration to improve imaging care, that we're completely funded by CMS to carry out this program. So there is no cost to either the referring clinicians nor the radiology practices.
Great, thank you. The next question comes from, looks like a PTN that is on the call. They're asking, once RScan is in place, can data be easily extracted by PTNs or practice transformation networks? The before and after comparison could be or would be beneficial for us to know to report on cost savings for CMS.
Yes, and the answer to that is absolutely, and we're working with a number of PTNs on a variety of ways. It's easily accessible. We can provide data by participating practice that's enrolled in the PTN, and we're also working with a few PTNs to look at their state health exchange information to see how we might use that data to populate some baselines. So, you know, every PTN is a little bit different, and we're really happy to engage in conversation about how we can provide data in the most efficient and effective manner.
And there's Nancy's contact information again if you wanted to follow, if any PTNs on the line wanted to follow up with Nancy. The next question I have is Jane, if you wouldn't mind fielding this question. This question comes from Deborah. Deborah is an adult nurse practitioner with a community, with a standalone community clinic. She says, we have a high volume of clients from correctional facilities, shelters, etc., with a history of multiple imaging services. What is the best way to address my staff with the benefit with establishing a network with a local radiologist?
Well, I think it's extremely important. I'm sorry, was it Debbie? The name?
Deborah.
Deborah. It's extremely important, Deborah, to have actually a relationship with a local radiologist, and RScan can facilitate that relationship, obviously, and have the best opportunity for consistent care for different treatment facilities. Do you use different imaging centers for these different treatment areas, or is it, is that helpful? I'm trying to understand the context of the question. If there's different radiology centers that they need to communicate with,
I can unmute Deborah for a moment if she'd be able to clarify.
Sure, that would be helpful.
Deborah, you're unmuted.
Yes, good afternoon. Thanks so much for reading my response. Yes, I just sent in. We have a lot of individuals with various Medicare, Medicaid coverage, and some of the individuals' clauses will have them to, I guess you would say, mandated to use certain facilities. So that is one area where we struggle. However, we do have 2 local radiology sites that is available for the majority of our individuals.
Do you have the ability to have choice about these, what facility you use? Because if you do, it would be very beneficial to include RScan with the facility that you would choose to use, and also for you to have that education as well to best. I think you could make the case to the people that you're working with that this is going to actually streamline and create great efficiencies in both your ordering of the imaging as well as the follow-through with the imaging centers.
Yes,
I would guess.
Yes, yeah. And that is the struggle with, for some of the individuals who are being managed for immunosuppressive disorders. There are 2 particular healthcare insurances that requires them to receive all of their services, any specialty service at one of the local hospital clinics. Yeah. So that sort of squashes us out of the network within a large hospital. So sure. We usually cringe when that individual comes in, but you know, because now they have to wait on the hospital to obtain the referral from them.
Yeah.
Where individuals, we're able to just shuttle them to one of our local radiology clinics.
Yeah. Well, it sounds like that's a kind of a complication. I'm happy, Deborah, to talk offline and in case anyone else has some questions. But I can certainly get you my information and we can talk offline and talk more about this sometimes our hands are somewhat tied by things we can't control, but I'm happy to talk offline about your issue so I can wrap my mind around it and hopefully help with that.
Thanks for that, Nancy. And Deborah, or if there are any others out there that have questions that are that they're looking to get some perspective or clarity from an NP perspective, if you just go ahead and send those questions to me, I can definitely forward them along to Jane. But moving along, we're running short on time, and we still have a couple of questions I would love to be able to get to. So the next question comes from Tanya. Tanya is asking, will this prolong the time necessary to order the test, or will it delay treatment in any way?
I'm happy to take that, and really it's in the long run, it should make ordering streamlined and more efficient, because the program is about learning to order high-value imaging and to cut out low-value imaging. So in the long term, it really is about improving ordering efficiency. So the actual program itself won't have an impact on timing for image ordering, since we're looking at imaging cases that were ordered retrospectively. But through the educational process, we'll have a positive impact on future ordering of images. And Max, I don't know if you have anything else to add to that.
You might be on mute, Dr. Wintermark.
Sorry. Nothing specific to add.
Okay, so the next question, and we probably only have time for maybe one or two quick questions. So the next question comes from, let's see, Joyce. Joyce is asking, can the tool be used to determine appropriate ICD-10 codes for diagnosis?
And Jason, perhaps do you want to comment that? I don't think so. I think it's more to determine the correct appropriate test once you know the condition, but not necessarily to determine the appropriate coding of the condition. But Jason, perhaps you may want to comment more on that.
Yeah, I agree with that.
Okay, great. Thank you. And the last question comes from Nancy. Nancy is asking, what is the upside for the radiology facility to implement this or utilize this?
So there are multiple of them. So often in radiology practices, we have a lot of requests, and so sometimes it's hard to accommodate all of them, and it creates delay and access problem and that kind of things. And so I think RScan is an excellent way to address those access issues in a collaborative way with our referring providers. So I think that's one reason. And another, and probably the most important reason, is that we're always interested in really proposing and using the imaging technology that we offer in an appropriate fashion. And again, RScan offers a great way to interact with our referring providers to determine, because we don't see the patient, and so sometimes it's hard to basically use our imaging expertise. But again, RScan offers a great way, again, in a collaborative fashion to interact and make sure that we help patients as best as we can.
Great. Thanks so much, everyone. So I just wanted to say thank you to everyone, all the presenters involved in today's Lunch and Learn, Dr. Holm, Dr. Wintermark, Nancy, and Dr. Jane Anderson. I really appreciate everyone taking time out of their busy schedule to chat with us a little bit about this very worthwhile and valuable resource. So coming up next on March 1st is the next Lunch and Learn event, where it's going to be part one of a four-part series dealing with patient safety in practice. And we're going to be discussing the use of the teach-back method. So their registration for this has gone live, so if you have an interest in it, please feel free to sign up. Otherwise, thank you everyone for joining us, and I will go ahead and sign off now. Have a great day.
Thank you. Bye-bye.
Thank you.
Bye.
Bye.